Hello friends, today's topic is polycythemia. What is polycythemia? When RBC count is raised and hemoglobin level is raised, both are raised, then it is known as polycythemia. What is the level? Level hematocrit value in male, hematocrit value is 49%, okay, and more than 49% in, and this is hematocrit value, and this is 16.5 is hemoglobin concentration, okay, and in females it is more than 47% and hemoglobin is 16 gram percent, okay, 16 gram percent hemoglobin. Then it is known as polycythemia. In infants this is 65% or more than 65%. But in infants and children, the criteria for polycythemia is different. Okay, this is polycythemia. Now, types of polycythemia. Types of polycythemia may be divided into number one, that is relative polycythemia. Relative polycythemia. Okay, relative polycythemia is due to decrease in blood volume or plasma volume, loss of fluid from the body. In cases of dehydration due to any cause, nausea, vomiting, diarrhea, burn, or in case of diuretics, when only fluid portion are lost, then fluid portion are lost, 4 elements are present, and they will increase, hematocrit value will increase. This is relative polycythemia. Okay, in this case erythropoietin level is not affected. Okay, this is relative polycythemia. Now coming to absolute, this is absolute polycythemia. Absolute polycythemia is of two types, primary and secondary. Primary and secondary. This is relative. Okay, this is relative polycythemia. This is absolute type of polycythemia. In primary type of polycythemia, defect lies in bone marrow. Primary polycythemia defect lies in bone marrow. What is the defect? In RBC formation, pluripotent stem cell is there, okay, and there are receptors for erythropoietin. Erythropoietin receptors are there, okay. When erythropoietin is produced by liver and kidney, especially kidney. When erythropoietin attaches here, this causes activation of JAK2, Janus kinase 2, JAK2. JAK2 will lead to formation of RBC, WBC and platelet. Stimulate this, and lot of these cells are produced. Okay, this is in normal condition, and when there is defect, there is mutation in JAK2, then it is not dependent upon erythropoietin. When there is mutation in JAK2 gene, it is not dependent upon the erythropoietin. It will form autonomous blood cells, okay, leading to polycythemia. Defect is here, okay. This is also myeloproliferative disorder. Okay. Now coming to, it is benign hereditary. Autosomal dominant mutation in the erythropoietin receptor. Okay. Now coming to secondary causes. Secondary polycythemia. Causes of Secondary polycythemia. Secondary polycythemia is mainly due to increased level of erythropoietin, increased erythropoietin level, and erythropoietin level increases in hypoxia. Hypoxia is a powerful stimulant of erythropoietin secretion. Erythropoietin level increases, and that will lead to formation of increased RBC. Okay, normal condition. The hypoxia due to any cause. It may be in high altitude, it may be due to chronic obstructive pulmonary disease or sleep apnea or cyanotic heart disease. In anything, these may cause hypoxia leading to polycythemia. Then certain drugs, testosterone, anabolic drugs are helpful in formation of RBC leading to polycythemia. Then blood transfusion, certain cancer, liver tumors and renal cell carcinoma. Then post-transplantational polycythemia. In some cases, after renal transplant, there is polycythemia. Then some genetic mutation that causes inability of the body to sense oxygen level. Oxygen dissociation curve is disturbed, and this lead to secondary polycythemia. These are the smoking. Then smoking, certain types of hemoglobin, methemoglobin, etc. causes secondary polycythemia. Okay, these are the causes. Now, symptoms and signs. Causes, definition, causes, then sign and symptom. Sign and symptoms, this is seen in whether it is familial, and then congenital, okay, clubbing, etc. are seen. Sign and symptoms include headache, transient blurring of vision, there may be sudden loss of vision, transient ischemic attack, stroke, vertigo, faint, lightheadedness, syncope. Okay, these things are due to sign and symptoms are due to clotting, formation of blood clot due to excessive RBC, WBC platelet. There is increased viscosity of blood. Viscosity of blood increases, and that causes sluggishness of blood flow in the capillaries and in end arteries or other sites. This may block. There may be formation of blood clot. Okay. Then dizziness, fatigue, pain in limbs, erythromelalgia, etc. are the features. These we may say non-specific. Then pain in dizziness, fatigue, itching, pruritus over whole body, then rash, and one feature is itching, especially after hot bath or hot shower. Okay. Now tingling, numbness in different parts of the body, cyanosis, hypertension, splenomegaly, hepatomegaly, clubbing, cyanosis, and redness of face or palm. Okay, paresthesia, and these are the features of polycythemia due to increased viscosity of blood, and this may cause damage of any system, and then rapid destruction of RBC causes increase in uric acid that will lead to gout. Okay, then due to these things there may be dyspnea, blood is not flowing properly in lungs, and there is no proper oxygenation of blood. Then this will cause dyspnea and other features of lung diseases. Then chest pain, angina may lead to myocardial infarction, then congestive heart failure, mild myocardial damage, leads to this congestive heart failure. These are the signs and symptoms of this polycythemia. Now, how we will diagnose? Family history. Number one, family history. Duration. Family history, then duration, lifestyle, smoking or something like that, other diseases, cyanotic heart disease, COPD, etc. Okay, pleuritis rash, history of pleuritis rash, transient blurring of vision, transient astigmatism. These things we will see in history, family history, then history of present illness. Okay, history of present illness. Then CBC, complete blood count. CBC, complete blood count. Then somatic, JAK2 mutation is positive. This test is available. Somatic JAK2 mutation is positive. Then third is erythropoietin estimation. Erythropoietin is raised in secondary type of polycythemia, but it is normal or reduced in case of primary polycythemia. Primary polycythemia is also known as polycythemia rubra vera or polycythemia vera. Okay. Then bone marrow. These things will show, will diagnose, confirm the diagnosis of polycythemia. Now treatment. What is the treatment? Number one, the main treatment is removal of blood in few months. Okay, removal of blood in few months. This is known as phlebotomy. Okay, this is known as phlebotomy. Then treatment of associated condition. If there is gout, then treatment of gout and anticoagulant aspirin is added and other drugs are given, and then lifestyle change must be there. Okay, these things are in short for treatment of polycythemia. So in this video we covered what is polycythemia, number one, then types of polycythemia, causes of polycythemia, signs and symptoms of polycythemia, and treatment of polycythemia. Okay, there is nothing left in this polycythemia in my opinion. Okay, then please, it is my request to like, share and subscribe the channel. Okay, thank you very much for watching.